Welcome to the Green Nurse Podcast, everyone, where we bring hope and inspiration for growth and healing. We're here to change the dialogue and stigma around what it means to feel good and be high. Hence the H for hope, I for inspiration, G for growth, and H for healing. You deserve to feel good. We all deserve to feel good. And here is a little video about what we do in the cannabis space as nurses. And then we're going to get into our very exciting, controversial show. Partners in Health, here we come. Boom.
Change the paradigm of healthcare.
The Green Nurse is a holistic cannabis nurse that teaches on the endocannabinoid system and the safe utilization of cannabis and other progressive tools to help people reach a better quality of life.
I'm the founder of Holistic Caring. We're based here in California, and we do educational programs and case management for patients on how to use cannabis therapeutically as a medicine.
We're also here to decrease stigma around what it means to feel good and be high, hence the H for hope, I for inspiration, G for growth, and H for healing.
As the founder of Holistic Caring, I basically oversee the whole ship. And what we're doing is progressive education.
Cannabis actually supports all 11 organ systems, our immune system, and all the neurotransmitter signaling systems that give messages to tell our body to either do something or not do something. Because the plant was prohibited, it prevented health professionals, doctors and nurses from learning about cannabis as medicine.
I want to change the paradigm of healthcare and us paving the way into a new vanguard of medicine.
It's about education, it's about empowerment, it's about teaching people how to feel good, bridging the gap from what they're not getting from traditional medicine, utilizing different plant medicines, adaptogens, tips, tricks, hugs, and nugs of information to support and nourish the most important system in our body.
It's a lot of soul work, a lot of love, a lot of discipline, and meditation. I'm using my life work as a testimony to others to learn how they can be their own hero and then go help heal the world.
And we are, as nurses, the game changers.
All right, growing your health, growing in cannabis. Hey, everybody, my name is Sherry Mack. I'm Chief Nursing Officer and co-founder of Holistic Caring and the Green Nurse and Vice President of Bloom Hemp CBD. And I am a cannabis nurse, a cannabis patient, advocate, activist, and a very passionate podcaster here to change the paradigm of healthcare. And I'm really excited to announce that this is my 7th year podcasting The Green Nurse Living Your Best Life. I started podcasting in 2018 when the National Council State Boards of Nursing came out with their guidelines that all nurses must have 6 essential areas of knowledge when it comes to cannabis as medicine. I started podcasting to share compelling stories of healing and to decrease stigma, since I too use cannabis as medicine. Cannabis nursing has been recognized as a specialty, and nurses are truly making an impact on advocating for the safe and therapeutic use of cannabis by teaching on the endocannabinoid system and how to optimize cannabis as medicine for health, healing, and wellness purposes. This show is going to be a little controversial, and I'm really excited to get started. But before we get started and I introduce our guest and our theme, I'd like to make an announcement from our sponsors at Bloom Hemp. And I want to say thank you so much to Bloom Hemp. Bloom Hemp is a woman and nurse-owned national CBD supplier leading with quality, safety, and valued and patient-centered care. Bloom Hemp products are USDA organic hemp, grown in the mountains of Colorado and tested for purity, potency, cannabinoid, and terpene profiles. Bloom Hemp is proud to offer a free nurse line to answer questions, explain how and why CBD works in the body. And Bloom Hemp has an evergreen coupon of Green Nurse for 10% off. And this is the nurse line. And thank you so much, Bloom Hemp, for making this podcast possible. Very grateful. So again, we're going to talk about cannabis, and we're going to talk about cannabis hyperemesis syndrome. So I'm just going to reiterate that the therapeutic use of cannabis has been defined by the American Cannabis Nurses Association as the use of cannabis products for health, healing, and wellness purposes. It is personal and subjective to each person, with objective criteria being improvement in one of the 5 health domains: biological, mental, emotional, spiritual, and social, without negatively impacting any of the other health domains. You're either using cannabis therapeutically or you're not. It's as simple as that. And so today we're going to dive into Cannabis Hyperemesis Syndrome, which is a rare condition that has sparked the interest of over 150 studies. And despite current research, Cannabis Hyperemesis Syndrome remains a mystery and is poorly understood. However, cannabis has been used for thousands of years by millions of people worldwide, and it's puzzling that a condition with such distinct symptoms, such as cyclical vomiting, which we're going to talk about, relieved by hot showers and other modalities, was first identified only in the late 1990s. The existence of CHS, or Cannabis Hyperemesis Syndrome, and the potential role of modern high-THC cannabis strains in its development should not be dismissed. However, attributing Cannabis Hyperemesis Syndrome solely due to cannabis use, often cited occurring in the absence of other causes, oversimplifies a very complex issue. So a deeper, more nuanced analysis is truly needed, particularly focusing on cannabis chemotypes consumed by CHS patients. Notably, just going to mention this for the record, there has yet to be a single documented case of CHS linked to cannabis chemotype 3. And cannabis chemotype 3 is the full spectrum CBD products that we see on the market today that contain less than 0.3% THC. Similarly, thousands of MS patients that have multiple sclerosis, consistently use full spectrum cannabis extracts, predominantly chemotype 2 that has a balanced THC to CBD ratios, also without having any reported cases of CHS in this patient population. So this truly highlights the need for a more comprehensive understanding of the underlying factors that contribute to CHS. So to truly understand it, it's essential to examine the connection between cannabis chemotypes and its symptoms, rather than settling for an oversimplistic explanation. So far, research on CHS remains limited, over 150 studies, with only one study investigating the possible influence of additional cofactors. In 2021, Dr. Russo and a team of conducted genomic analysis suggested that CHS may stem from a gene-environment interaction. And this interaction could be triggered by toxic levels of THC in individuals with this rare genetic predisposition. We're going to talk about that. Another hypothesis points to contamination of cannabis plants by hop latent viroid as a potential cause. Again, there are promising case studies suggesting that topical capsaicin, which is a TRPV1 agonist, can effectively alleviate CHS symptoms. Yet the important question remains unanswered. There is no research has examined the potential of CBD, which is another TRPV1 antagonist, as a potential treatment for CHS. And so this gap underscores the urgent need for further exploration into the underlying causes and potential therapies for this complex condition. Back in 2018, this is a long time ago when I first started podcasting, I recorded my first podcast on CHS featuring a male patient who shared his personal journey with the condition. I was also joined by Dr. Jordan Tischler, who provided his expertise on the perspective of this rare disorder. And so for more details on this podcast, please check the show notes for that episode. But today, here we are years later, circling back around to the topic of cannabis hyperemesis syndrome, because it is important and it's not going away. And so we must discuss it, we must talk about it, and we must research it. So today's guest is a licensed vocational nurse who was diagnosed with cannabis hyperemesis syndrome, and she's here to tell us her story and what she's now doing as a CHS nurse in our community. Katie Nava has been a licensed nurse since 2008, gaining extensive experience across bedside care, wound care, gastrointestinal care, and administrative roles. In 2015, Katie personally developed CHS, although she was not officially diagnosed until 2019. She's going to tell that story. And since her diagnosis, she has dedicated herself to helping hundreds, if not thousands of individuals understand and recover from CHS. Katie manages 3 social media platforms focusing exclusively on CHS and is collaborating with other nurses and medical professionals to develop an IRB-approved study. I'm going to share that in a little bit. And this initiative aims to deepen the understanding of CHS and educate healthcare providers on recognizing and diagnosing it in its clinical practice. That was a very long-winded introduction, but welcome to the show, Katie.
Thank you so much for having me.
Yes, thank you for coming on and sharing your story, because this is a very sensitive topic. It's putting you in a very vulnerable position, but I think nurses are the most trusted profession for over 22 years in a row. And what you have to say, your story that you have to tell, is so, so important as we move forward in the cannabis space as nurses, individuals. So welcome.
Thank you.
Yeah. So, okay, here we go. So just going to dig right in.
Okay.
Tell us about your relationship with cannabis and what led to your diagnosis of CHS. Because I know you didn't. Because I know you definitely didn't want to have this.
No. I'm a very pro advocate. I love marijuana. I would love a cure for CHS so I can have marijuana back. I smoked weed pretty much my whole life. I will say, in my head, I thought it was medicinal. It was helping my anxiety. It was helping all these things. I started smoking when I was like 15 years old. I smoked all the way until I was 35 with absolutely no problems whatsoever. I quit smoking for pregnancies. I quit smoking for all kinds of things, no problems. And then in April 2015, I got drugged one night at a bar. And I found this out because a friend of mine also got drugged. So it wasn't just myself. And I just had a very weird relationship with alcohol from that point forward. And I really genuinely thought I had gained like an intolerance to alcohol. Something happened. I spent the next 4 years being sick. Nausea, extreme nausea. I lost tons of weight. I'd seen every specialist under the sun. I had multiple colonoscopies, upper GIs, specialists, cameras up my nose. I tried everything for like 4 years. And I was smoking to feel better. In my head, it was nausea. I wasn't hungry. So I was taking marijuana even more and more and more, to the point where I really wasn't even feeling it any longer. But it was the only thing that curbed my anxiety. It was the only thing that helped me eat. It was the only thing that, did a lot of things. And so I would be in the middle of an episode vomiting and forcing myself to smoke weed because everybody knows weed makes that better. And it wasn't for 4 years. In January of 2019, I had changed insurances and I went into a different doctor, and the emergency room triage nurse said, "Do you smoke marijuana?" And I said, "Absolutely." I was always very open about my usage. I never hid it. And nobody ever asked, ever. And I did not get relief from hot showers. So when I was searching things and Googling things, that was not a red flag to me. I'd never heard of CHS ever. And so it wasn't until that day I walked into the emergency room and the nurse said, "Have you ever heard of this?" And that was when I got diagnosed, but it took me about 9 months to quit from there. But
yeah. So, okay. So how did you treat it? Like, so what was
at the time?
Yeah.
When I first got diagnosed, the doctor told my husband, first thing is take that vape pen out of her hand. And, if you can get her to do anything, make her stick to flower. She's still going to get sick, but have her cut the pens out. That was like the number one thing the doctor recommended. And I did do that. I cut any and all vape products out immediately. And I cut just to flower. And I was still getting sick, don't get me wrong, but I thought I was going to beat the system. So I spent 9 months cutting back, but still having problems. I never got better. I was still having really bad postnasal drip. I still had really bad heartburn. There were certain things. I was 114 pounds at the end of my 9 months of I tried Ativan, I tried Benadryl, I've tried, everything, me personally, to treat it. But magnesium glycinate was a huge, huge help. Even in my recovery phase, once I finally did quit officially, I did not get better until I quit. I had one day, 8 months into it, and I had tapered down. I thought I quit cold turkey, but I really tapered substantially over like 8-9 months. And I just quit one day. And within 3-4 months, I was better. But it took a couple weeks. It was pretty bad for the first few weeks, and it was bad for the first couple months. And then it just was okay until it was good. But treated it magnesium, digestive enzymes, Benadryl is huge, and electrolytes. That's my trifecta is electrolytes, digestive enzymes, and magnesium glycinate. That's what I recommend to everybody. And that was my key everything to getting better. And then once your stomach is stable, a B vitamin. I see B vitamin deficiencies all the time on people with CHS. Thiamine, specifically B1.
Right. Wow. So there's a lot of people out there that, and I'll just kind of say it bluntly that, people, particularly health professionals, if someone comes into the emergency room throwing up, they automatically label them with CHS or cannabis use disorder if they found out. So we need to talk about the difference between greening out, which is taking too much cannabis and getting sick, versus cyclic vomiting syndrome versus cannabis hyperemesis syndrome, because they're 3 completely different things, not even the same.
Well, for one, greening out is temporary. So you probably—
Greening out is temporary. There you go.
I mean, it's not going to last months and months and months. It's going to last you, maybe that night. I've heard a few people say into the next day if they ate, maybe 1,000 milligram edible or something, and it really did them in, maybe 24 hours, they're not feeling wonderful. But by 12 hours or so, you're probably back to normal. That's not the case with CHS. Right. Cyclic vomiting syndrome, it slows your stomach. Speeds your stomach up. Cannabinoid Hyperemesis Syndrome speeds your stomach up. So they're completely opposite in that regard. So that's a big key. If you're having diarrhea and vomiting and everything's flying out the back end of you, you probably, it can be CHS, but usually, especially if you don't smoke weed, it's definitely CVS. For CHS, we usually are constipated. It slows our guts down. When we throw up, it's our whole meal. There were times I would eat dinner at 7 o'clock at night and wake up at 3 a.m. and I would throw up my food like I didn't chew it at all. And so that, I think, is a big key difference, and not only that, cyclic vomiting syndrome can be treated with marijuana and marijuana products. That helps it, where with CHS, it's the opposite. That's going to make you worse every time. The only way to treat CHS is to quit smoking weed at this point in time.
There you go. So regardless, if people are throwing up, right, this is the reason why they're throwing up, particularly with CHS, is because these TRPV1 receptors actually hide. And then in your GI tract, what's happening is that slows gastric motility. And so you got to think of your gastrointestinal system goes from your mouth to your bum, right? And it's constantly moving. You have constant movement. So you can imagine if your stomach says, I'm good. So your TRP receptors are hiding. They're going away because they don't want any more THC, right? They're saying, I'm good. I'm done. I don't need any more. So it's a protective mechanism of the body. But at the same time, when it's hitting the TRP receptors on the enteric and vagus nerves, it's actually altering gastric motility, slowing it to the point where whatever you put in isn't going anywhere. So it has to come up.
And I think it's an important thing to note also with that, people don't feel good with CHS. And when you don't feel good, are you walking around? No. And when you have stomach or abdominal surgery, one of the first things they do is get you up and walking to get the digestion moving. We don't feel good and we're laying on the floor throwing up and we're laying just miserably half the time. We don't have any energy because we're tired and we haven't eaten or whatever, but we're not moving. And so our stomachs aren't moving from that also. So we're not helping it either. You know what I'm saying? It's slowing down from the THC and then we're slowing down, and everything about weed is dehydrating. So you're also constipated with that. That's not helping the situation.
Right. So the difference between CHS and cyclic vomiting syndrome is CHS, you have slowed gastric motility, With cyclic vomiting syndrome, you have increased gastric motility. And the difference is cyclic vomiting syndrome could be relieved with cannabis, where CHS is actually causing it. The high THC cannabis is actually causing the CHS to begin with, where cyclic vomiting syndrome is being caused by other factors.
And other than that, they're so similar, though. It's scary.
They are.
Especially, it's common to see people with cyclic vomiting syndrome as a child that never used weed, and then, or they turned to weed to help their cyclic vomiting. And now it seems like they have CHS, and it's really hard to tell them apart.
Yeah.
And that's getting, and because the CVS patients are treating with, and then if it's not working and they are kind of sister syndromes, it becomes questionable at that point. Like,
yeah. And that's where that testing is so important.
I came back positive for that testing. I would like to add, I have nothing but respect for Dr. Russo and his team. I took that test personally, and I came back positive for 4 of 6 of those genetic variations.
Let's talk about the test. Tell us about this test and what's going on. So if you look in the show notes, everyone.
This is a different test. This is a study, and from Dr. Russo's test, they're different.
Oh, okay. Yes, this is a different test that you're doing.
Yeah, they're totally different.
All right, let's talk about you doing Dr. Russo's test.
Dr. Russo's
the one
test
that I mentioned in 2021. So the one that okay.
Yes. That's just a genetic test. He checks for if you have, there's 6 variations in your DNA that people who have CHS tend to come back positive for anywhere from 1 to 6 of those variations. And that is it's not a determining factor that yes, you have CHS, but it is something to be considered if you have a genetic predisposition. Like I said, I have CHS. I came back positive with 4 of those 6. So to me, and then I have 2 cousins that are both full blood biological, like our mothers were sisters kind of related, and they both have CHS. So there's definitely some sort of, I know of a father-daughter duo. I know quite a few people that, it's not as common as people individual, but like, it's not unheard of to be running in the family.
So you participated in this and you actually tested positive for some of the genetic markers.
4 out of 6 of them.
Wow. Okay. And you have CHS. Okay. So
I know I have CHS. I don't doubt that.
I know. So this is truly like, so in other words, it's connecting the dots.
As far as I'm concerned, that test worked because and I feel like if I had taken that test when I was 18, just randomly, and someone said, hey, just so you know, just kind of like we do breast cancer, just so you know, you have a genetic predisposition for this. Now, honestly, obviously it's a different treatment, but if somebody had warned me that I probably should actually be careful and use my weed medicinally and not smoke as much as I want, as often as I want, whenever I want, I would have been aware of that. And I wasn't, and when everybody said weed was safe and the dispensaries rolled it out, nobody said anything about potency or that they were going to triple the strength or do any of those things. And so it's scary, that we do have this predisposition because our bodies produce cannabinoids, naturally.
That's it.
So
we have an endocannabinoid system.
Yeah, it's
the cannabis plant, but because we make molecules very similar.
Exactly. Like we produce them, and that's why, we receive them well. But we also, we can overload on them. Yeah. I've said to a million people, tell me something you can take as much of, as many of, as often as you want, with no repercussions.
Well, there isn't even water.
Take vitamins and that.
Water and get into trouble and die.
Exactly. I mean, if I can overdo the water, why can I not overdo marijuana? Or like very specifically, one of the 400 ingredients to it. I mean,
yeah. So let's get into this next study, and then I want to talk about some of the different components of CHS.
So this next study, I got together with a couple colleagues of mine, and we basically put together the different symptoms that we see frequently within CHS, and we composed the study to try to help kind of red flag it in the ER to say, hey, these people are coming in and they're throwing up, the nausea, just the red flags. Ask about, do you have our hot showers helping you, or does heat help you? Because it doesn't help everybody. Sorry.
That's okay.
There's so many. Did you go to the doctor? Do people believe you? It's all the different things that we've come up against with CHS. What helped you? Because there's such a wide variety. Like, what helped you feel better? Magnesium is pretty much across the board for everybody. But, so we're trying to gather this information of these red flags and these major indicators of CHS. And it is in an IRB approved study so that we can get it published and get to the doctors and the nurses and the staff and get them the information and get it into like the medical journals and stuff where they need the information at that level to say, hey, this is real. This is a thing. This is happening. Pay attention to these people. You know, when somebody is throwing up and it won't stop, did you run a urinalysis on them? Did they come back positive for marijuana? Have we explored that avenue? You know, we see gallbladders get taken out all the time, appendixes. These are all red flags. And so this study picks up all of these things. It asks, we've had over almost 1,000 people participate on the first half. And I want to say close to 500 people on the second half. There's a gift card, by the way, 3 on each side, if you do them. But so we're just trying to get the information and the numbers to say, listen, like 95% of people, I want to say it was more like 99 to 100% of people had nausea, like across the board, that they couldn't stop with anything else. And that Benadryl, of all things, antihistamines, was helping. So this is what we're trying to identify is what is the problem? What helps it feel better? And then what were your red flags? What were you doing before you were diagnosed with CHS? Had you started smoking a pen? Had you really ramped up your use? Did something traumatic happen in your life? You know, what is going on with you when all this happened? And so it was broken into 2 parts because it is kind of a big survey because there is so much to CHS. There really is. And so that's why there's 2 parts, but we've gotten really good feedback. And so we're really hoping to get the information to the doctors of what is CHS, what are people experiencing, like real people, you know, not people speculating, but real people who are sick. What is going on with you?
Yes. And so with the groups that you run, what are you seeing? What is the main?
I am currently getting an overload of early 20 kids with heartburn. That's the number one thing that's the first thing I'm seeing. Like
so kids that are in their 20s that are complaining of heartburn.
My youngest patient is 14. My oldest is in her 70s. But my average age currently is around 35. And I'm getting an influx of early 20s. And I mean, early 20s, 22, you know, early 20s. And I'm asking them, you know, what's going on? And it's heartburn and then the nausea and the stomach pain, but heartburn seems to be a big red flag. And then are you eating properly? No, I've completely lost my appetite. Are you losing weight? Yes, I've lost a couple of pounds, you know, and if the heart rate goes up, there's so many things. The postnasal drip is a big one. For some reason, like we're constantly clearing our throats and it never will clear. Going to the doctor repeatedly for colonoscopies and there's nothing wrong with you. Elevated white blood cell counts. For some reason, it's very common. You go to the ER and that you have an elevated white blood cell count, but they don't know why. I've had multiple labs run. I've seen a lot of people come back with like allergens to wheat and things like that, but I'm not sure if that's from lack of eating or if that's from, you know, terpenes or what. I have many theories in that regard. But the main thing I see is heartburn, nausea, vomiting, and stomach pain. And it's right where the V of your chest gets soft, where you would, you know, it's called the xiphoid process. That's right where a lot of people's pain is. It's like dead center in their chest. And, you know, for me, I was explaining, it's like, it was for like a knife was in my stomach and it just turned and nothing stopped it. The traditional, like Zofran didn't help me. Haldol, I never tried, but I know it helps a lot of people. Magnesium was significant for me on a daily basis. In the ER though, they would give me usually like Ativan or it would be Benadryl in the IV. And that would be what would stop my stomach pain and actually make me feel better. Like something that put me to sleep. That's when I learned the connection. I would eat at night when I was sick. And so that's another thing I ask people, are you eating more before bed? You know, are you taking like Unisom or Benadryl or something to sleep at night? And that's when you're realizing you can eat. And they're saying yes. And so it's like, you know, these all things sound familiar. And it's little stuff that you start to pick up on.
Wow. That's really amazing. So that kind of brings into the 3 phases of cannabis hyperemesis syndrome. Mm-hmm. So you talked about we've got the prodromal, the hyperemetic phase where you're actually throwing up, and then recovery. What does the prodromal look like for people?
Prodromal can go in cycles. So people can go, first of all, to make it just so it's clear, CHS is a cycle syndrome. So it is very common for someone to go from stage 1 to stage 2 to stage 3 and then right back to stage 1. If you don't quit, you're going back to stage 1. So every time. But your prodrome symptoms are always going to be their nausea, their vomiting, their stomach pain, it's lack of appetite, it's heartburn, it's those transient symptoms that you just don't feel good. And a lot of times you'll attribute it to, I drank too much last night. Did I eat something bad? Or, the heartburn is the biggie. Why do I have heartburn all the time? And then all of a sudden, like for me, I would have a half of a beer or a stressful situation, and I would wake up the next morning at 4 a.m. sharp. And I hear this across the board. 4 a.m. we are morning nausea people. I think I was explained it's the circadian cycle. It's that shift in the middle of the night when we're waking up and our serotonin's picking up and our melatonin's going down. That's right when we get nauseous. And it's like 4 a.m. people wake up. I would get gurgle guts. Like I had to go to the restroom, like badly. And it would be almost painful. I would like literally almost expel everything out the backside painfully with cramps, sweating miserably. And then once that was done and I couldn't take it anymore, it was like time to turn around and spend the rest of my day throwing up. That's your hyperemetic phase. And it almost always starts with a bowel movement for most people at 4 a.m. And then it goes into throwing up. And some people will vomit off and on throughout the day. Most people will throw up consistently every time they eat. For me, it was every morning. I would, not every morning, but when it would happen on my episodes, I would wake up, I would have my morning movement like that. And then I would start throwing up. It was almost like that was so intense. It made me nauseous. And then I would throw up to the point where like there was nothing left, because this would go on for like 18 hours where I would be laying on the floor naked. Like I hadn't eaten in 2 weeks. I'm 114 pounds. I look like death. And I'm just dying on the floor and nothing helps my pain. And I'm forcing myself to smoke weed, I might add, because I'm thinking it's going to help me. And the pain was just immense. It's so bad to the point where, and I'm a nurse. Okay. You have to like be dying in front of me at the ER. I called, my best friend is a nurse. And I'm like, you have to help me. Like I'm dying. And she came over and she thought I was dying. And that's when I actually got diagnosed. But it wasn't until they give you like Ativan in the IV or morphine to knock you out, or, Haldol and Benadryl is usually a really good combination for people to knock that out. And it's not until you can make that stop that you feel any better. And sometimes that can go on for weeks for people. I had a young lady who's, I think, 24. That stomach pain carried on for her for about 6 months. 6 months. But she wasn't in an episode. It was just dragging out. So she was already in recovery. So your hyperemetic phase is when, so your stage 1 is going to be when you're symptomatic. Stage 2 is when you're actually vomiting to the point in the stomach pain and the vomiting is out of control. We coined a term scromiting, which is screaming while you vomit. That's also on that survey. Who screams when they're throwing up? Not many people. We do. It's painful. So you're screaming. It's a forced thing. Sometimes we get confused with being eating disorders because, like, personally, I would shove my finger down my throat like every 5 minutes. I couldn't help it. I had this nausea in me, and it was like I knew that if I could vomit, it would kind of feel better, but it would come back in 5 minutes. So I was literally like every 5 minutes putting my finger down my throat and gagging, and the nurses lose their sympathy for you because they think that you're doing it on purpose. That's the hard part. I can spot somebody with CHS in the emergency room in a split second. It's terrible. But so anyway, and then when you go into stage 3, that's your recovery stage. At that point, usually you've quit smoking weed. You have to quit and stay quit. Most people will stay quit for like the first week or two because they don't feel good. But once they feel better, they don't believe it. And if they don't stay quit at that point, they're going to go back to cycle 1. They just are. They pick the weed back up. A lot of people think they can moderate it. We are addicts. We wouldn't be here if we weren't. I don't even know how else to put that. Pure definition of addiction is if you're doing something that harms you and you can't not do it, that is an addiction. I know that weed hurts me, yet I'm going to continue to smoke it. I am clearly addicted to the weed. Okay. Like that is just how that works. It offends people, but it is what it is.
But it's a statement of fact.
It is a fact. So and that's really rough. And so like when you're in recovery, there's so much, you have to recover. You have to stop smoking weed. You have to get therapy. You have to get the right diet. You have to get a good support system. That's why I run 3 platforms. 1's for information. 2 are actually supportive for people. I'm accessible. I have a team of people on the Facebook page. It's just me on TikTok. But I mean, I talk to people all day long and help them get through recovery and stay away from the weed. That's the hard part.
And this is the page right here.
That is my information page. That's one of them. So that one is where if you want to know all about CHS, the information, I always share everything in that page that I share on the recovery page. But this is an information page for anybody who wants to know about CHS. As you can see, I share my TikTok videos there. I share the slides, videos, any articles about CHS. It has to be credible. That is my other page. That is my my actual recovery page. That page has about 1,900 people on it now. It's trucking along. We get about 130 people a month, I would say. We're about 2 years old. And that one is, we do a Zoom every week to support people. They can talk about anything to do with CHS, ask questions, talk to people. We have a chat, that same thing. It's so active. There's always people talking about what's going on with them. People compare their symptoms, like, did this happen to you? People do not believe CHS is real, or that it's them, or that it's been 3 weeks and the doctor said that this would get better. And then I don't feel better, or the doctor said I could smoke weed and now I'm smoking weed again. And so this page is, I find, critical for people's recovery. I move a lot of people from TikTok over to here if I can, because it's just an easier place to get information out. But I will say my TikTok has like 3,300 people maybe that follow it. And it's grown way faster. It's only like 6 months old. And that actually, side story, my son, I've had my CHS Facebook page for a couple of years, and I ran another one on Facebook for a couple of years. So I'm 4 years into the CHS pages. And my son said, Mom, if you want to reach a bigger group, you have to go to TikTok, or you're only going to get old people. Yeah. And I said, thanks, babe. I appreciate that. You're 20, bless your little heart. I'm going to go where the young people are apparently into TikTok. And I will tell you, it blew up. I get one-on-one. That's where I pick up so many 20-year-olds with CHS. And then I get parents that are like, oh my gosh, this is real. And my kid is going through this.
And this is really great because, you're even covering things of potential food triggers and helping people to eat, because when they can't eat, right, it's like you need to find something that can stay down. So I
love the trigger food list. So just to put it out, the trigger food list is just foods that contain cannabinoids.
There you go.
It's a quick Google search. And if you, I have a quick theory. I'll do it quickly. My terpenes, I kind of feel like these foods, if you were heavy, like a quick example is I was a big sour diesel fan. The profile of sour diesel is very similar to that of truffles and mushrooms. And guess what? Truffles and mushrooms were the only trigger food that bothered me. However, I will say black pepper, cinnamon, carrots, those are big, big, big ones. People get really sick from those.
Well, there you go. And then beta-caryophyllene.
Yes. And I question, with CHS, I've seen people be completely symptom-free and still be positive for marijuana in their system. I have seen people be sicker than dogs and be completely negative of marijuana in their system. This is like a broken endocannabinoid system. It's not the active THC in our system. It's the damage that was done when we were doing it. And the system needs to heal. Right. And like once it heals, most people don't have problems with these foods ever again. Most people. Now, I will tell you, there are some people that can never eat cinnamon again. Black pepper is always a problem, and they're 4 or 5 years sober. And I do believe that's where terpenes come into play. I think we kind of developed an allergy. And I personally think we've kind of got an allergy system going on with the terpenes. Benadryl, antihistamines help us. That's a red flag, in my opinion. Yeah. Along with the foods, not one person has ever been bothered by every one of those foods in my experience, ever. Yeah. It's always hit and miss.
Hit and miss. And then you have this dehydrated. Being hydrated is one of the most important things too. You're growing up.
The number one way we excrete cannabinoids is by having a bowel movement. So if you are constipated, you are getting toxic levels of THC in your system as it is. And then to top it off, everything about weed's dehydrating. And everything about what makes weed feel better is also dehydrating. All antihistamines are dehydrating. It's what they do. They dry us up. There you go. Everything we do to feel better dehydrates us in my book. So that being said, even the foods, eat a banana, eat things that, that aren't on the trigger food list. Well, they're binding foods. Electrolytes are really important. I will say, I'm going to throw out there, be very, very careful, with your sodium content. If you have high blood pressure, always a red flag warning. I'm not your doctor, but I'm a huge fan of electrolytes, especially if you're dehydrated, especially if you think you need an IV, you need electrolytes. There's sodium. That's it. It scares me when people replace electrolytes with potassium. As we know as nurses, that window being so small, it scares me when people down a prime. Also, too much potassium becomes a diuretic and people are just drinking it, and they're messing up their potassium levels. So unless you've been told by a doctor, I'm an electrolyte person, just the sodium. I don't, and magnesium's big. But the hydration is massive.
Yes.
Massive. Drip Drop tastes good for reference. That's why it's at the top of the list. Liquid IV is everywhere. Pedialyte is everywhere. Drip Drop actually tastes good. The rest are syrupy.
There we go. And here we go. Fast lane to recovery: electrolytes, magnesium glycinate, digestive enzymes, B complex. And it's really interesting. This sounds like when you're hungover. This is what people need.
It does. You know, when my friends are drinking now, I recommend all these same things. I still carry electrolytes, and I can't drink very well anymore. That's the one thing. I can still drink alcohol, but I stick to gluten-free vodka, which is weird because I can eat bread, but I cannot drink any other alcohol besides gluten-free vodka. And when I'm hungover, electrolytes, I need them immediately. I practically do them at the same time. I could do them at night. I don't hydrate well, and I don't regulate my body temperature well 5 years later.
There you go.
Those are the two things I still have to be careful of.
There you go. Well, these were absolutely fabulous.
I love that.
Yeah, deep down, you know, that's right. Well, that's what it really is. I mean, we really, therapeutic use of cannabis is a use of cannabis products for medicinal, wellness, and healing purposes. It's subjective to each individual, but objective criteria. You need to have improvement in one of the 5 health domains without negatively impacting any of the others. So
I think aside from the stomach pain, people don't realize the negative impact it has on the mental health either.
There you go.
It really does increase anxiety. It really does. If you overdo it, over time and too much use. If we overdo it, not medicinally, but recreationally.
And that's clinically, there is research that shows that overconsumption of THC actually causes a downregulation of cannabinoid receptors, actually causes changes in dopamine and serotonin signaling, which changes our ability for reward and sensitivity. And also, oftentimes people tolerate things that they normally wouldn't tolerate. So you might tolerate abuse a little bit more because you're numb, distracting, and avoiding.
You don't realize it, I think. You do numb out things like that.
Yeah.
You numb out things like that, absolutely. Those are big things, though. Little things you don't realize is eating. Okay. I used to be able to go to the fair and eat my way through a carnival, and all of a sudden I couldn't eat anything. I couldn't eat a French fry. Like, everything made me sick. For reference, I'm like one of those weird women that'll tell you my weight. I am 145 pounds. I'm 5'7". I am very healthy. I'm 44 years old. I'm a good, healthy weight. Just 5 years ago, I was 114 pounds. I was a skeleton. I thought I looked okay. When I looked in the mirror, I thought it was cool that I wore a size 23 jeans and that I was the same size as like a 16-year-old. I didn't see it. Now I'm like, oh my gosh, I look at those pictures. I think back on how many holidays I missed, how many outings I missed, how much I missed because I couldn't eat. I couldn't leave the house. I had to have a vape pen. I had to be able to travel. You don't realize those little things that add up much more than the big things. Like, your friend can see that you're being abused and tell you. That's big. You know what I mean? And you'll know deep down that you are smoking to medicate to allow that. And you know that you're allowing that. Yeah. You don't really realize that you're not eating lunch today.
Yeah.
And enough doing that, you become completely out of homeostasis. You are completely malnourished. Big problem. Your vitamins and minerals are completely out of whack. Your food, again, back on that digestion. If you're not consuming the right foods, you're not getting the enzymes from those foods to complete the circle to break them down. So an example, if I haven't had milk in 3 months and then I drink a glass of milk and it makes me sick, I'm not lactose intolerant. I just need to rebuild those enzymes back up in my system. Yeah. Which is why I so recommend those digestive enzymes to everybody. I love those digestive enzymes. I use a brand I got at a local grocery store that one of their vitamin specialists recommended to me. And it was for heartburn originally. And I used them to not only naturally get rid of my heartburn, but I realized I wasn't hungry because I was full of acid. And when I took the enzymes, within 20 minutes, the acid died down. I reabsorbed it. Then I was starving. I could actually eat a meal, and I had the enzymes available to my body to like break down the meal. And I started gaining my weight back. It was a huge difference. So, and then being dehydrated, we don't have hydration. It's like a car. We have no gas. We have no oil. We are kaput. We need to replenish those really important systems.
Yes.
So
that's what I wanted to ask you too. Are there any misconceptions that people have about CHS?
I think the biggest misconception is currently that you can go back to weed. You can't, not and be symptom free. Okay. In my 9 years with CHS, and I do have friends, ironically, that we kind of went through CHS together. So I've never had anybody tell me they could go back to smoking weed and not have symptoms. Now, are some people really good at moderating their use and they actually only smoke once a day or once a week or socially? Yes, I'm sure it can be done. But again, I will round back to most of us are addicts. We didn't get here by doing it once a week or socially. And if when you're carrying a vape pen around, think about how often you're doing this. We suck our thumbs before we're born. So this hand to mouth motion is ingrained in all of us as human beings. So that vape pen is coming to your mouth every 5 minutes, all day long. And
that's where I question too about CBD being a potential helper in that.
I don't know. I personally would not recommend CBD in the initial stages of recovery, only because I've seen people
connected
foods interacting on their stomach, foods, black pepper bothering somebody's body and making them nauseous and feel symptomatic again, even though they're a month clean. They eat pepper and all of a sudden they feel sick. Or a female will get her period and have like a recurrent, it's a mini episode, because they're not nearly as big as like the original ones when you're still smoking, but it's not unheard of for especially women on their cycle monthly to have flare-ups and have little mini episodes and things in it. That's where hormones definitely come into play and stuff like that. But I wouldn't, until those things die down, I wouldn't try CBDs. Not me personally, because I would be afraid to eat black pepper. Yep. I mean, and it's way less cannabinoids than a straight CBD, which is a cannabinoid, but down the road, I would say, me personally, I wouldn't be opposed to trying a CBD product. I'm, 5 years under my belt. I would definitely, I'm a good guinea pig. I don't like to recommend things on my page that I haven't tried myself. So I honestly would try it. I should try it. So I can.
When I did the research through Cannakeys, that was one of the questions that they were posing is, would it be, because CBD can be used for addiction.
I had one gentleman who was a doctor. He was an anesthesiologist, and he used CBD to treat his CHS. I do know he knew it was completely against my advice, but he was like, I'm going to do it anyway. And he set up a taper, like it wasn't a taper, but it was a dose, much like you would do. This is the problem. This is what I'm trying to target. This is the correct, CBD cannabinoid or whatever. And he was doing the proper doses daily. And he had a relatively quick recovery, but he's a one-man person. I can't compare him to say if it worked. I really don't know overall.
But I was just thinking too, like, along the lines of, with you think about anyone coming into recovery from any substance whatsoever, they have endocannabinoid systems that are out of balance.
Yeah.
And particularly, that mental, emotional, spiritual component and being in the fight or flight response, right?
Huge.
CBD can
all
help
the time.
Calm. That's what it is. We want to promote the relaxation response.
That's why we take the magnesium. So it's the same thought process. It's honestly, it really is. That's exactly why we take magnesium. It's the calm.
Yeah.
And it's a restoring of balance and calm. I just don't know. I haven't had enough people to do it that I could personally answer on that.
Yeah.
I've only had one gentleman do it. He did say it worked. He was a physician, but I don't have anybody else to compare to give like an educated answer on that.
That's okay. That's all good. So finally, the question that no one wants to hear is, what are the dangers of CHS?
The worst danger, you can die.
There you go. People have died of it.
People have died of it. It's seizures. You won't. I have seen actual autopsy reports where it's complications of cannabinoid hyperemesis syndrome, and those complications are typically heart failure and kidney failure. Those are your number ones. It's the electrolyte imbalance. You will have a seizure, your heart will stop, your kidneys will fail. Pick one, pick all three. They all can happen. It just depends on how bad you are, how bad your electrolytes are out of balance, how bad you are, when did you eat last? I mean, there's a lot of factors. It's not common to die. Most people catch it, obviously, but there have been some people, it's the electrolytes. They don't restore them. They need an IV. They don't go the ER. They don't get the IV. They're throwing up, and then they have a seizure and it's too late. It is not common. It does happen. But the number one thing I would say in the long run, like the reason I wouldn't even consider like trying to get around my diagnosis, I don't want to tell my kids in 20 years and I'm on dialysis because I had to smoke weed. That was more important than my kidney function.
There you go.
So to me, it's the kidneys. We are chronically dehydrated. I smoked weed for 20 years. I know my husband is diabetic and he has better kidney function than I do. And I mean, literally, like when, they compared the numbers, I was a 10. The doctor's like, I'd rather see you at like a 15. My husband was like a 15, 16. I don't remember what number he was looking at, but it was the kidney function and mine was much lower. And my husband's like 10 years older than me and he's not a stoner. He never has been. He's, mine was definitely worse. So the kidneys, that's the one I'm always out to protect. I tell people if you're going to smoke anyway, do the electrolytes. If nothing else, hydrate yourself.
Yeah.
So
for our viewers that are out there, how can people find you?
My TikTok is up. I know there's a link on this right now. I've got my TikTok page. I've got my CHS page. I'm always in my direct messages on both of those. So if you can even, my personal page on CHS, it is connected to my recovery page and you just direct message me on Messenger, on Facebook, or on TikTok. I'm Nurse Katie CHS on TikTok. It's my lovely face.
Yes.
You can't miss me and you can message me there. I'm good about my messages. That's one thing I stay on top of. I know with CHS, people don't feel good. Nobody wants to read through the whole page to get the information they're looking for. They want to ask and know right now. So I try to be available. I have like 6 people that work with me on the CHS page on Facebook. Everybody's there to answer questions. Everybody's there to help the recovery.
Yep. I'll pull the page up one more time so people
It's great.
can see. Yep. Share the screen. It's important. Therapeutic use of cannabis, again, can happen. But if you have CHS, you need to avoid cannabis.
Yes.
And so this is a page and resource for you all listed in the show notes. Very, very grateful to have had you on today.
Thank you so much for having me.
I've learned something new. I hope our viewers have learned something new. This isn't a fear-mongering campaign. This isn't
this is a we want a cure campaign.
We want.
I love marijuana. I want marijuana back in my life. I just can't have it. This isn't a syndrome I don't want to scare anybody. If anybody, I want to educate in advance. Do not abuse weed. It is not what it was 25 years ago. It's 3 times as potent as it used to be. You don't know where it came from. You don't know what's in it. You didn't grow it. And it's exponentially stronger. It's weird that when dispensaries of marijuana became legal, CHS became a thing. Okay. CHS was not a thing until 2004 is the first documented case, to be specific. And I remember going to a dispensary around 23 when I was 2000, and that would have been 2003-ish. So
this is truly about preparing and preventing.
Yes, preventing.
Instead of repairing and repenting, right?
And not getting, because you can't go back.
Exactly. So
There's no going back.
We
if
want
somebody
to
warned me.
Happening. Yep. So we're here to educate and empower you. So Katie, it's been an absolute pleasure to have you on here. Happy holidays, everyone. This is my last show of the year. So I was honored to have Katie on.
So special.
So special. Yes. And we will be back next year for our 8th season of The Green Nurse, Living Your Best Life. And remember, everyone, what it's truly all about. It is all about living your best life and helping others do the same. And I'm going to end with my favorite other high video.
We're here to educate and empower patients to make choices that are best for them. We're also here to decrease stigma around what it means to feel good and be high. Hence the H for hope, I for inspiration, G for growth, and H for healing. The The Green Nurse is a holistic cannabis nurse that teaches on the endocannabinoid system and the safe utilization of cannabis and other progressive tools to help people reach a better quality of life.
I was cannabis agnostic for many, many years. And you know, the more research I did, the more I discovered that cannabis is this amazing medicine.
I was told that I had a 4-stage pancreatic cancer. The doctor really told me he couldn't do anything else. He gave me her name and she called me and she came to my house. She started to give me cannabis. My oncologist was puzzled because he couldn't find the cancer anymore.
All of the learning that we get comes from the Green Nurses group, comes from their support, comes from their guidance. I trust everything that she says.
Simply meet people where they're at. The plant doesn't, stress to grow, so we don't stress to share it. We're healing people.
Cannabis has been used as a medicine for tens upon thousands of years. Here's the big message. Cannabis needs to be federally legal. We need to have laws that are the same across all 50 states that allow access to anyone and everyone who wants to utilize this powerful medicine.